Good afternoon, everyone. Thank you so much for joining us. My name is Cassie Hopkins, and I help coordinate the webinars and events for Hausman Johnson Insurance and the Benefit Services Group. I would like to welcome you so much to today's webinar, Can Employers Apply Premiums, Surcharges, or Incentives for Vaccinations? This webinar is interactive and will feature a question and answer session. Feel free to type in a question at any time during the webinar, and Sarah will address it in the Q&A portion of the presentation. A little disclaimer about our Q&A session today. Sarah Borders is not a lawyer, nor is she a director of HR, so please try to keep your questions to be compliance related. But if you do have a question that falls in line with more of a HR or legal topic, we can direct it to our part of the HR consulting firm at our agency at Hausman Johnson Insurance and the Benefit Services Group. After the webinar is over, there will be a short survey we are hoping you can fill out for us to give us more feedback on the webinar, as well as more webinar topics you are interested in learning more about. This webinar will be recorded and will be available on the webinar archive section of our website. Each attendee will receive a follow-up email with a link to the recording and the presentation slides. I would now like to introduce you to our speaker, Sarah Borders of Benefit Compliance Solutions. Sarah has spent the last 15 years in the employee benefits industry. She has numerous designations and serves on the NAHU Employer Working Group Subcommittee and is an active board member of the Austin AHU. She recently stepped down as Vice President of Benefits Compliance at one of the nation's largest brokerage firms to start her own compliance consulting practice. Her designations include an active license with the Texas Department of Insurance, CEBS, Certified Healthcare Reform Professional, HIPAA certification, and Healthcare Service Associate. She holds an MBA from Texas A&M Corpus Christi and a BA from the University of Incarnate Word. Her consulting firm, Benefit Compliance Solutions, partners with employers to identify unknown risks and avoid hundreds of thousands of dollars in fines and lawsuits from failure to comply with their healthcare obligations. Thank you so much, Sarah, for joining us, and welcome.
Thank you so much, Cassie, and I appreciate all of you being here today. I know this is a bit of a moving target that we're dealing with right now as a result of the executive order that was issued just last week. I know many of you are very curious about how that is going to impact your business. We are going to cover that at a high level today. However, my expertise and our expertise really lies within the employee benefits compliance. So things essentially that touch the health plan, this is what we're going to focus on today. And so this is going to really come up if you're considering offering either an incentive or some sort of surcharge, either taking the carrot or the stick approach to get people to take the vaccine. So let's go ahead and jump into today's presentation. So again, we're going to touch quickly on the September Path Out of the Pandemic executive order that directs OSHA to issue emergency temporary standard rulemaking that kind of makes employers mandate the vaccine. And so we're going to look at that briefly. Then we're going to turn our attention to the vaccine incentives under the health plan, which implicates or can implicate the EEOC rules under the ADA, Americans with Disabilities Act, and under GINA. Also, it could implicate, and likely does, bring in the HIPAA wellness program rules. And so when you offer a wellness program that implicates these various rules, then they have extra hoops that you have to jump through. And you have to make sure that you're understanding what offering an incentive or some sort of penalty actually means for you and what you need to do to make sure you're compliant. We'll also talk about how a wellness program and incentives such as vaccine mandate will likely implicate the affordability calculations if you are an applicable large employer. In other words, an employer who's subject to the employer mandate and ACA reporting. How is that going to impact your affordability calculation? Also, we'll talk about privacy and confidentiality issues with getting this information back and forth related to the vaccine. And we'll go through some best practices as it stands right now. So if you have any questions, please type them into the Q&A. Again, if we get into, I'll tell you what I know so far, and we don't know a lot this far, but if it's related more to employment or HR law, please feel free to ask your question and we can get you the answer from the HR side of things at Hausman Johnson ESG. So as you all probably are aware, last week, I believe on Friday afternoon, the White House issued the Path Out of the Pandemic executive order. And so this is essentially a six-pronged approach to try to squelch the pandemic and get people vaccinated. And so there are many portions and pieces of this executive order, but we're going to focus on the part that really is called basically vaccinating the unvaccinated. That's the portion we're going to focus on today, and then we'll move over to the incentives part. So this directs OSHA to issue vaccine and testing rules under an emergency standard. And so the emergency temporary standard, which can only last about 6 months, and it requires PTO to be given to get the vaccination or to recover from the vaccination. Now, this vaccine mandate will apply to employers with 100 or more employees. It also applies to federal contractors and those that are part of the SCA or Surface Contract Act, as well as those facilities who are reimbursed by Medicare or Medicaid. So that could be hospitals, clinics, dialysis clinics, nursing home facilities. There are a number of facilities that are, of course, reimbursed by these various, by CMS for Medicaid and Medicare patients. So that's going to encompass those types of employers as well. All employers who are covered by OSHA that meet this definition here will be required to comply with the Emergency Temporary Standard, or ETS. There are no timelines set forth yet for the OSHA to issue this rule. However, we expect it to be probably about a few weeks or so. This ETS can last for up to 6 months, and then it must be replaced by a permanent standard. And so I know what you all are probably thinking right now, most of you anyways, are what actually determines 100 or more employees. And we actually don't know that answer just yet, but there are some good guesses out there. And so we'll talk about those in just a moment. But essentially, if an employer does not comply with this mandatory vaccination policy or implementing a policy, covered employers who ignore this standard could face OSHA citations and penalties of up to $14,000 per violation. So this isn't totally clear about what exactly is a violation, but it likely means a fine up to $14,000 for each facility inspected by OSHA where a covered employer hasn't implemented this mandatory vaccination policy or otherwise complied with the ETS. Of course, the ETS hasn't been issued yet, so we don't know what it says. This is just, again, an executive order directing OSHA to create rules. And so we have not a lot of information to go off of at this point. And again, as I mentioned before, we do expect this rule to be issued fairly quickly because of the nature of this situation, emergency. So we should see regulations from OSHA within the next few weeks. So we'll have to kind of hold tight, but there are some things you can do now as it relates to getting prepared to comply under this rule and other various rules. So once this is issued, the ETS will have an immediate effect on 29 states where the federal OSHA rule has jurisdiction. So where there are states that don't have federal jurisdiction, basically there are states that have their own rules, and that could be such as states such as California, Tennessee, North Carolina, Kentucky. These states have their own rules, and in that instance, these agencies will have to adopt the ETS itself or a just as effective measure. So essentially, everybody's going to have to comply, whether they fall under the federal jurisdiction or state jurisdiction. They will have to come up and meet that standard. And that will have to happen within 15 to 30 days of issuing of the rule. So just a quick note about which federal contractors are actually implicated, because some of you may be a part of the federal contractors or have federal contractors. But effective immediately, these new rules will apply to any new contract or new contract-like instrument, including new solicitation, extension, or renewal or exercise of an option provided that it is a procurement contract for services, construction, or lease in a real property. So we're getting pretty technical here. A contract who's covered by the Service Contract Act, or SCA. A contract for concessions, including concessions excluded generally under the SCA, and a contract in connection with federal property or lands, offering services for federal employees. It doesn't include contracts under grants, Indian tribes, those with value or less than the FAR simplified acquisition threshold, agreements involving employees performing work outside of the US, and subcontracts solely for provision of products. So if you are involved with any federal contracts, you're going to need to look at this rule closely. Again, this is more a matter of employment law, but I just wanted to outline what the executive order is directing, and it kind of is building upon some prior rulemaking related to federal employees, federal contractors. So some questions to be answered. I mentioned this before. How will this 100 or more employee threshold be determined? So it's unclear right now how that employee threshold will be counted. Will it be considered on a per location or company-wide basis? We're not quite sure yet. But given the other standards that mandate certain requirements based on employer size, it will likely be based on the total number of workers employed by the company. But it's unclear whether the control group rules will come into play here, or if we're looking at one entity, one FEIN. Not exactly sure yet, but this is something that hopefully the OSHA rule, the ETS, will clear up right away. So will employers be required to obtain proof of vaccination? Again, we don't know this yet, but if you do have to obtain proof of vaccination, which it's looking like that will be what you have to do, then there are medical record timeframes that you have to keep these records, in other words. So if the ETS requires employers to collect proof of vaccination, then you may be required to maintain that record for the duration of the employee's employment plus 30 years. So that's kind of a rule under the ETS. Again, that's not determined yet. It's just a best guess at this point. Who pays for testing? In all likelihood, the health plan already has to pay for testing. The vaccination is already covered, whether you're uninsured or insured. And so likely the plan or the employer or the federal government will be paying for this testing and or vaccination. Will it face lawsuits? Absolutely. I fully expect for this to face lawsuits. In fact, this is such a broad sweeping policy, and many governors have already said, and certain states have indicated that they intend to challenge the ETS once it's issued. So it's possible that a court could even block enforcement of the emergency rule until the legal challenges are actually resolved. So that remains to be seen, but it's certainly likely in this kind of climate, especially with the different states and how they kind of perceive infringing on rights as opposed to public safety. So should be interesting. What type of testing will actually be required? Unclear again, but we hopefully will have some sort of direction from the ETS that it mandates a particular type of COVID-19 test, whether it's an antigen, PCR test, or some other type of acceptable test. Of course, the PCR is more accurate, but it takes a lot longer to get the results. And lastly, the question that comes up over and over again is, will remote workers be included? And based on what I've been reading, unless the ETS specifically addresses remote employees will likely not be covered under this emergency rule. OSHA largely avoids addressing safety issues concerning employees who are working from home. So that's, again, some guesses on these questions to be answered. So we'll have to see what comes as a result of the ETS once it's issued in the next few weeks. So just some areas to consider as it relates to the mandatory vaccination policy as required under the ETS. So you'll want to adopt procedures for vaccination status. Again, I really encourage all of you to connect with HR, employment counsel, or employment or HR consultant, especially Hausman Johnson BSG has these resources, but these are just some high-level things for you to consider. Determine if the vaccine is mandatory or if you're going to permit weekly testing for the unvaccinated employees as it directs in the executive order. So that may be required, but if you are going to, and maybe you don't, maybe this won't apply to you because you're too small or another reason, then you'll want to consider, are we still going to mandate vaccinations? And if so, are we going to require weekly testing for those who refuse to be vaccinated? Also, you want to plan for accommodation requests. So under the Americans with Disabilities Act, the ADA, generally speaking, the ADA requires accommodation requests. So you'll have to really thoroughly think through these requests and make sure that you have a process in place to deal with these accommodation requests. And there should be a procedure in place, again, probably reviewed by employment law counsel. Have a plan for tracking test results, managing those, making sure they're kept confidentially. If they implicate a wellness program, which I'm going to talk about next, you want to make sure that they're treated as protected health information under HIPAA. And just plan according to the OSHA and CDC guidance. And I can say with a lot of confidence that, can you mandate vaccinations? Yes, of course. We know that now it's going to be, but the answer was kind of unclear a week ago, and now we know that, yes, you can mandate vaccinations, you know, under the CDC, the trends, the federal government, the EUC rules, the Department of Labor, they're all pointing in that direction. And so it's safe to say that you can mandate if you were wondering before. And so for those of you that are thinking about, which was the original intent of this presentation, was to really talk about incentivizing vaccinations or imposing a surcharge for vaccination, because we all saw in the news a few weeks ago that Delta Airlines had imposed a premium surcharge for those who chose not to be vaccinated on their health plan premiums. And so this is what we're going to focus mainly on today. So if you have to mandate the vaccination, then why would you offer an incentive? That was one of the questions that first came to my mind when I first read these rules. And I thought of a few reasons why you would want to continue to offer an incentive, even though you perhaps have to now mandate the vaccination or have some sort of weekly mandatory policy of testing. And so there's a few rules, or a few reasons here. So the employer wants to foster goodwill and help further encourage vaccination for workplace safety. So that's an entirely reasonable reason to have an incentive on top of a mandate. So you want to encourage employees to make them feel good about getting vaccinated, to educate them, to give them another reason to get a vaccination other than the kind of stick approach. You want to provide a carrot. And so this can be a way to foster that goodwill and really kind of promote workplace safety in an environment where this can be particularly political and contentious. This is just another way to possibly make people feel more at ease and you know, give them a reason to get the vaccine. Also, the OSHA ETS won't apply to your organization. It doesn't apply. If it doesn't apply to your organization, you're too small to be included in this mandatory rule. So perhaps you have 50 employees or 80 employees, and you know, we find out that the threshold is counted a specific way, and you still determine that you're under 100 employees, then maybe this rule doesn't apply to you, but you still want to encourage people to get vaccinated, and you don't really want to take the full carrot or the stick approach of mandating a vaccination. So perhaps then at that time you want to offer an incentive instead. So maybe you're not a federal contractor, maybe you're not a facility receiving reimbursements from Medicaid or Medicare. Again, you're too small, you are out of these rules, and therefore you want to provide a different way for employees to be vaccinated. Again, that's why you would offer an incentive. Also, when we have more people supposedly that are vaccinated, perhaps it can have an impact on the claim spend, especially if you're self-insured. So This is one of the reasons that Delta Airlines said that they were implementing a surcharge on their health plan, was because it was impacting their claim spend so heavily. That was the reason that the CEO wrote in the article that was published a few weeks back. So if you are self-insured and you may already have a wellness program or have worked somewhere that had one, and it does have a pretty good effect on the behavior of your employees, this could also be a very interesting way to impact that claim spend, especially as it relates to COVID-19 sickness or hospitalization, weeks on end in the ICU certainly can have an impact on your claim spend. Something to think about of why you'd want to offer an incentive. Now, if you do decide to offer an incentive or surcharge, then there are a few various rules to consider, which we talked about before. So we have the EEOC Guidance. The EEOC, they are the organization that is in charge of rulemaking and in charge of enforcement under the Americans with Disabilities Act and under GINA. The Americans with Disability Act, or ADA, is really what is quite pulled in by these vaccination incentives and surcharges. Also, we have the HIPAA wellness program rules, which are brought in only when there's a premium surcharge or incentive applied to a group health plan. So if this is outside the group health plan, maybe it's some sort of gift card, water bottle, t-shirt, some sort of PTO given, extra PTO given for vaccination, that is not going to be pulled in under HIPAA. And the reason is because HIPAA only applies when you're talking about a group health plan. So if you have a group health plan, which most of you do, and the incentive is somehow tied into that group health plan, whether it's premium surcharge, HRA, incentive given to someone's HRA, their HSA, maybe an FSA incentive. There's many different ways. Maybe you apply a surcharge or you give an incentive, you allow them to pay less for their health insurance premiums, then that is when HIPAA is pulled into the mix. And if so, if you're kind of doing anything with your health plan premiums or the HRA, then the ACA affordability determination can be impacted. And I have a very specific example to show you how implementing a vaccine incentive would actually change the determination of how you determine if your plan is affordable or not. Also, there can be privacy issues, confidentiality issues when you have this information relating to vaccine status going back and forth, especially if it's pulled into your wellness program, then that creates PHI, protected health information. So let's look closely at the EEOC guidance. So the EEOC back in May this year issued an update to their FAQs. So I have linked in the last slide here all of the FAQs that they have released or they have published that relate to COVID-19 and various employment law issues. But they updated a few of their FAQs to include how they are going to see this under their wellness program rules. And so a few highlights here to think about. It confirms these rules, or these FAQs confirm that the employer may require a vaccination to return to work. And again, remember, these rules were issued several months ago before the mandatory executive order was released for the ETS. But it also confirms that an employer must provide an accommodation due to disability or religious belief, and that has not changed. And so if you are used to having to provide accommodations for religious beliefs or disability related issues, then this is the same. You're going to have to provide an accommodation, and that can take various ways that you go about doing that. But this is going to implicate those rules as well. However, these rules confirm that a voluntary attestation, meaning you ask an employee if they were vaccinated or not. You don't ask for proof, you just ask them to attest to the fact whether or not they were vaccinated, and confirms that that is not in and of itself a disability related inquiry. So that does matter for the wellness program rules, because if you are asking information that's considered a disability related inquiry, then the incentive that you offer for that information cannot be over a certain amount. But they've confirmed here that that attestation or proof of vaccine is not considered a disability-related inquiry. You may offer an incentive to those who provide documentation, but the rules depend on if the employee or the family member get the vaccine from an outside provider, such as a pharmacy like CVS, Walmart, some grocery store, doctor, clinic, anywhere else besides within the employer's organization, or if you have like a third party working on behalf of you as your agent. Now, I would say that if you have a third party that you use, they can sometimes be separate from the employer. That doesn't necessarily mean they're representing you, but I think there's a little bit of a gray area there. But it's clear that if they get vaccinated from an outside community provider, then you can offer an incentive of any amount. But if they do it internally with your organization, or perhaps with an internal clinic, then there are specific rules about the amount of the incentive. Again, if it's provided by the community, if the vaccine is provided by the community, CVS, doctor, clinic, etc., then the incentive to the employee is not limited in that case. Now, if it's offered by an employer or its agent, the incentive can't be so much that it's seen to be as coercive. So in other words, it doesn't say what exactly the limit is here. It doesn't provide any examples, but it just says that it can't be so high that it's seen as coercive. So we have to be careful about any vaccinations that you provide internally or on behalf using someone who is your agent. Then we have to make sure that the incentive is fairly low, maybe $25, a water bottle, again, maybe something very insignificant in that case. But again, if they bring you that attestation or that proof from outside in the community, then it's fairly unlimited unless you're tying it to the premiums, the health plan premiums, in which case we have to look next at the HIPAA rules. Very important, you cannot provide any incentives for family members because that specifically is considered genetic information under GINA. They consider that family history, family medical history of the employee, and you cannot provide an incentive or ask them for their spouse or dependents vaccination information. So just don't do it. Just keep it with the employee. Also, keep info confidential. They confirmed under these FAQs that this is considered confidential medical information under the ADA, not necessarily under HIPAA, which has a different set of rules, but under the ADA, which generally means that it needs to be stored separately from their personnel files, among other things, but that's generally what that means. So when you, again, have a premium surcharge or something that's related to the health plan itself, then it implicates HIPAA's wellness program rules. So when you've got these various rules that apply, you've got to consider, well, how do they all matter to us as an employer? How do we comply with each one of these rules? And so we're going to kind of bring it all together at the end. But let's focus right now on the HIPAA program, wellness program rules, which is what was so concerning to me when I read that Delta Airlines was going to impose this surcharge on their health plan premiums. Again, that is the reason why that was seen as so different from maybe mandating a vaccine or offering some other kind of monetary incentive that's apart from the health plan. That is why this is so different, and you have to be really careful with this. So premium surcharge for vaccination is probably what we would call an activity-only health contingent wellness program under HIPAA. So these rules have been around for a long time, since 2013, amended in 2015. And so these basically dictate what you can and can't do if you're going to provide some sort of financial reward or surcharge for meeting a health standard. And the reason for this is because HIPAA is particularly interested in making sure that they encourage healthy behavior and lifestyles, but also that employees are not discriminated against based on a health factor. And so where this can come into play quite obviously is making somebody ineligible because they have cancer, or making someone ineligible for coverage because they didn't fill out a health statement. And you can see that many employers would impose such types of limitations if they were allowed to. In fact, they used to. So this is why we have these wellness program rules, because There's an exception for wellness programs to be able to base those incentives on a health factor, but you've got to follow their rules if you want to do that. So it doesn't specifically, unfortunately for us, it doesn't talk about how vaccines are seen under the wellness program rules, because while we had flu shots and things like that before, this hasn't been something we've dealt with in the past. And so we have yet to see how the Department of Labor, who enforces these rules, generally speaking, will see these rules in light of a vaccination surcharge. Remains to be seen. Maybe we'll get some guidance on that, but for now, we have to just follow the rules that we know are in place. So again, it's pulled in because of the group health plan here. If this is something outside of the health plan, it doesn't apply. I know I keep saying that, but I just want to make sure that that distinction is clear. And because it is probably an activity-only health contingent wellness program, then it has to meet several standards, including a reasonable alternative standard, another way besides getting the vaccine to get the reward or avoid the surcharge. And so when we have a HIPAA wellness program, health contingent wellness program, it has to meet 5 different factors or requirements. First of all, it has to be designed to promote health or prevent disease, which is fairly easy to meet that standard. The individuals have the opportunity to qualify for that reward at least once per year. Under HIPAA, it says that the total reward cannot exceed 30% of the total cost of coverage. It allows more for tobacco prevention programs, but we're not going to talk too much about those today. Must provide also, as I mentioned in the previous slide, a reasonable alternative standard, RAS for short. A reasonable alternative standard, again, is another way that is kind of equal and on par, not, it's not more difficult. It just would be another reasonable way to get the reward back. And also the 5th requirement is to provide employees with a notice of availability of the reasonable alternative standard. There's model language for that we can provide for you, which is already probably included in your plan documents if you do currently offer a wellness program. So in looking back at this slide here, it's clear that a lot of these are kind of easy to pinpoint and easy to comply with, but in my mind, I think that the 4th one is probably the most difficult to provide, because we don't exactly know what is a reasonable alternative standard from getting a vaccine. We have some good guesses, but we don't have any guidance yet that says that this is, okay with the Department of Labor. So let's look at some possible examples of reasonable alternative standards, meaning the employee comes to you and they say, I'm not able to meet the standard of vaccination for whatever reason, and you have to give them yet another way. So Delta Airlines, in all likelihood, needs to give another way to get their $200 back into their premiums. And that could be possibly the first standard being getting vaccinated, could be attending a COVID-19 vaccine education program, perhaps. It can't be something that they have to, spend hours and hours a week doing. It has to be reasonable. Or perhaps being tested weekly at the employer's expense. That's included in the executive order, so perhaps that would be seen as a reasonable alternative standard in order for the employee to get all of their refund back. In some cases, if it's too difficult for the individual to meet the first standard or the reasonable alternative standard, and there's really no other way, then they may have to be offered a waiver of the standard where they can't meet the standard, but therefore they still get the reward back. Now, when the standard is actually met, the employer must refund all of the reward or surcharge, however you're going to approach this, back to the start of the coverage period. So if this is something, we'll talk about how this would impact plans if you made the change mid-year, but we're coming up on open enrollment periods, and so maybe you're thinking about implementing an incentive for your next plan year, maybe January 1, December 1, whenever your plan renews. You have to make sure that once they actually meet the standard, that they receive all of their money back from the start of the plan year. And so a lot of employers don't understand that, and that goes for any wellness program rules or tobacco surcharge. Once they meet the standard or the reasonable alternative standard, then they have to receive the money back to the beginning of the plan year, or if they were a new hire, back to that coverage period. So make sure that that's included in your planning processes. So one of the other requirements, as I mentioned before, is number 3, the total reward may not exceed 30% of the total cost of coverage. So I want to provide 2 examples, one of a permissible wellness program, meaning it is under that threshold, and one that is too high, that I'm going to use Delta Airlines again, because I think their premium threshold may be too high, but I don't know what their total cost of coverage is, so I can't be sure. So under the example of 30%, because again, this isn't tobacco related, so we're going to just assume it's 30% reward limit for a HIPAA wellness program. The annual premium for the employee only coverage is $350 per month. So yearly annualized, that would be $4,200, of which the employer pays $3,900 per year and the employee pays $300. So we have to look at the total cost of coverage, employer plus employee contributions. The plan offers employees a health contingent wellness program, which consists of a vaccination surcharge for those who remain unvaccinated or complete the reasonable alternative standard. Again, the other way to get the money back. The surcharge is an annual premium of $200 per month. Again, this is what Delta Airlines said they were charging, $2,400 per year. So since $2,400 is way more than 30% of the total cost of employee-only coverage, which is $1,260, that's the threshold that they would need to look at. And again, this depends on your own employee-only contribution for that employee, then that would be far too much. It exceeds the HIPAA percentage threshold and therefore isn't permissible. Now, on the other hand, we have a permissible wellness program. The threshold is met in this case. And so same facts as before, same amount, $4,200 per year for the employee, but the reward for compliance in this case is an annual premium rebate of $2,500 a month, which is $300 per year. So quite a lot lower of a premium rebate. In this case, they're giving a premium incentive. They're giving back employees money from their payment of their premiums. So since $300 is less than 30% of the yearly cost, which again is $1,260, that's kind of the threshold for this particular employer, their reward is under the HIPAA percentage threshold and therefore is allowed or it's permissible. So I mentioned before that wellness programs under HIPAA, they have an impact on affordability if you are an applicable large employer who is subject to the employer mandate. And so if you're doing your ACA reporting, you fill out your 1095-C forms, 1095-C forms, then this applies to you and you'll have to listen up here. So when you have a tobacco-related surcharge, the amount that the employee receives for being tobacco-free or meeting the reasonable alternative standard can be applied to the cost of coverage for the lowest cost plan. So that could be advantageous to offer a tobacco surcharge or reward because it could lower your threshold for affordability determination purposes. Now, non-tobacco rewards such as a vaccination, cholesterol, type of outcome to meet, BMI, health metrics, different things tied to non-tobacco related outcomes cannot be applied to the employee's contribution, and therefore they're not applicable to the affordability determination. So I put a pretty clear example here that shows how this would work in the instance of a vaccine. So an employer who imposes a surcharge where the employees who are vaccinated pay $100 per month for self-only coverage, which is affordable to all employees under the federal poverty level safe harbor. So if you're using federal poverty level as your safe harbor, then at this point, or starting in 2022, the most that you can charge an employee for the lowest cost plan for self-only coverage will be, I think, $103.15 if you're going to use that safe harbor. If you're going to use rate of pay or W-2, you might get away with a lot higher of a premium contribution for the employees, but in this instance, we're just using FPL, federal poverty level. So employees who are not vaccinated, though, are charged $150 for their self-only coverage. In this instance, the employer must report the cost of the plan to employees as $150 on all of the employees' Forms 1095-C. So in line 15, you'll have a box where you have to type in or include the amount that the employees have to pay for the lowest cost employee only coverage. And so that is the amount that you would have to use if you're going to implement a tobacco surcharge to your health plan premiums. That would significantly, in that case, impact affordability of the plan for most of its employees because you're using federal poverty level. And just as a reminder, if you have a plan that is not affordable and one of those employees goes to the exchange, gets a premium tax credit from the federal government, healthcare.gov, then that is what can trigger a penalty letter from the employer, and that can sometimes happen years later. So you'll want to make sure that your coverage is affordable under these determinations, as well as meets minimum value. So some privacy and confidentiality considerations when you are asking for proof of vaccine status for either a wellness program or just some other incentive, or because it's mandated now. So you need to consider local and state data privacy laws. So almost every state has specific data privacy laws and how you should treat employees' information. So you'll want to make sure that you understand any privacy laws that apply at your state. Also, don't ask for any info related to family members because, again, that implicates GINA. It's seen as family medical history, and you can't provide an incentive for family medical history. It's prohibited. Also, require the employee, not their provider or their doctor, to transmit the vaccine information, because if you have their doctor sending it to you, then you might have to get a HIPAA release form. And so it's just easier if the employee can transmit it to you directly, get it from their own doctor, and then give it to you directly. The EUC considers vaccination information specifically to be identifiable information that's subject to the ADA confidentiality rules, which we talked about previously. And just generally speaking, that means that that information has to be kept separately from their personnel file. HIPAA typically is not implicated in most of these situations unless the information is used for the wellness program tied to that group health plan. So again, that's what implicates HIPAA, is tying in the group health plan. And therefore, if you're asking for information related to their vaccination status, that could be considered PHI and would have to be maintained under the HIPAA privacy and security rules. That can be quite onerous. And if it is covered, again, under HIPAA, it's PHI, protected health information. So some vaccine incentive best practices. So if you are considering an incentive or some sort of surcharge, kind of beyond just mandating it, and again, just talking about wellness programs and tying it into the health plan, then we want to make sure that you consider whether or not to provide an incentive, a reward, or a surcharge, meaning you pay more if you don't become vaccinated. If the incentive is tied in with the group health plan, premiums, HRA contributions, etc., they consider HIPAA and EEOC wellness program rules, which we just went through. Identify a reasonable alternative standard or another way to get the reward. That's very important. Also provide required wellness program notices and disclosures. So there are 2 model notices related to the HIPAA rules as well as the EEOC wellness program rules. So you can use those if you're going to implement one of these. Ensure that the reward doesn't exceed those thresholds that I mentioned before. And consider how a surcharge is going to impact affordability if you're an applicable large employer, or ALE for short. If you, in other words, are subject to the employer mandate, over 50 employees plus equivalents. Manage your privacy risks, and any mid-year plan changes, they would actually probably open up a qualifying life event for employees because you have a substantial change that's being made in the middle of the plan year. And so what that means is that employees could make election changes in the middle of the year. Any employee that impacted would be able to make an election change that's consistent with that event. So be careful that if you're going to do this mid-year, you have to really think through, how does this impact my health plan and all the other rules that are impacted when I make a change mid-year outside of open enrollment. It also may require an amended SPD and a summary of material modifications if you're changing, especially if you're changing anything related to the summary of benefits and coverage. So again, mid-year plan changes can bring in a host of rules. Recommend contacting an employment law attorney to assist in reviewing all of your policies, because again, this pulls in a lot of the rules under OSHA, of course, but also the ADA for accommodations, as well as other rules related to employment law. So it's very important, it's worth it to contact an employment law specialist or attorney to review those policies and procedures, make sure that you are providing all the accommodations and so forth. And so I have published here just some resources. The executive order itself, it's pretty easy to read. I would encourage you to read The Path Out of the Pandemic if you haven't done so already. And then you can get a sense of what exactly the White House is ordering and this rulemaking, and get an idea of the spirit of this rule. Also, there is another executive order that was released in tandem with this for COVID safety protocols for federal contractors, if that is something that might bring you into the mix. And there are, as I mentioned before, COVID-19 FAQs published by the EEOC. There are many, many, many FAQs. They're really helpful, which of course were updated for the wellness program implications back in May, but it talks much about all of the EEOC's rules, ADA, and other accommodations under that set of FAQs. And so with that, we have time for some questions. If any questions came in, please let me know, type them into the chat.
That's right. And just a reminder to everyone that these slides will be available and emailed to you along with a recording in case you want to rewatch any particular sections or if you want to share it with anyone. With that being said, please type any questions you may have into the questions feature and Sarah can answer it at this time. All right, I'm seeing crickets right now. Are you sure anyone doesn't have any questions for Sarah? That must mean you must have done a very thorough job explaining.
That must be what it is.
Without seeing any questions, I just want to thank everyone very much for attending today's webinar. If you think of something after, Sarah's contact information will be in the email. And we do have someone who commented in the question a thank you. So thank you very much, Sarah, and thank you all for joining us. Have a great rest of your day and afternoon.
Thanks, everyone.